a 4-year-old boy presents to the clinic with intermittent fevers and a rash for 6 days. According to his mother, he is also complaining of pain all over his body. She adds that the rash first appeared on his face with 12 hours of the onset of fever and later spread to his trunk and limbs. The patient denies any itchiness over the rash. There is no history of a sore throat or recent use of medication for symptom relief. The temperature is 37.2 and the pulse is 88. On examination, there is a maculopapular rash on the face and trunk and including the limbs but sparing the palms and the soles. The pediatrician reassures the mother that this is most likely a viral infection and will resolve spontaneously. After 7 to 10 days, the boy is brought back to the clinic for a follow up visit. The areas affected by the rash appear to be having a central clearing, giving a lacy or reticular appearance, especially on the cheeks, and it looks like someone slapped him on the cheeks. IgM antibody detection enzyme linked immunoassay will most likely detect antibodies against which of the following pathogens. Okay, so I think this is a very, very big giveaway question. You would be lucky if you get something like this in your USMLE. This is like the go-to question. Like you cannot get this wrong unless, of course, you have not read it. So don't worry about it. For people who have read it, they will know. So yeah, this was a very, very direct giveaway question. They are talking about a rash with a central clearing, lacy or reticular appearance rash, especially on the cheeks, which someone has slapped. Okay, this is basically talking about the slap cheek appearance, which is seen in parvovirus B19. Okay, this is a very, very easy and direct question, but I will discuss other things about it as I want to talk about the other rashes too. Okay, the different presentations of rashes, which I have noted down and I'll be discussing. All right. So I'll be asking you the questions and you have to quickly give me answers. So when you have involvement of the palms and soles with vesicles and ulcers present in the oral mucosa, can you think of any microorganisms? Ulcers in the oral mucosa and oval-shaped vesicles on the uh, palms and soles on the extremities. Excellent. Hand and foot mouth disease. Very good. Caused by very good Coxsackie A virus. Excellent. Moving on to the next one. Then we have rose-colored macules. I am talking in the typical sense in which you will see questions in UWorld or something. Okay, so there are rose-colored macules, or they will mention a rash appears after several days of high fever, 3 or 4 days of high fever. Yes, yes, excellent. Roseola, very good, or human herpes virus 6. All right. Then we talk about a rash going from head to down, right? Associated with cough, coryza, and conjunctivitis. This one is a giveaway. Very good. Measles. And you have to remember these three things: cough, coryza, and conjunctivitis. Why I have told you these things? Because almost everywhere it will be present. Yes, I am not saying it won't cause a rash on hand and foot, measles. But there is a specific case scenario which I am giving. So if there is only involvement of your hand and foot, and it involves oral ulcers, this is usually a presentation of Coxsackie A virus involvement. That is the hand-foot mouth disease. All right. And when they're talking about measles, whichever question, you can pick up any question bank and see, pick up Ambos, UWorld, anywhere. The question stem will have the typical things. They will give a history of cough, coryza, and conjunctivitis, and associated with a rash. All right. We are talking about the typical presentations. Of course, you can have many exceptions, which I am also not aware of, which no one knows. But yeah, Koplik spots is there. That's a good thing, right? Okay, and then we have scarlet fever, like we discussed previously. So we have a sandpaper-like rash with circumoral pallor. All right, and then parvovirus we have discussed, slap cheek appearance, and it can cause hydrops fetalis also in pregnant women, right? And one more thing, you can have parvovirus B19 in adults also. Usually the question stem would be something like a teacher who's teaching in the primary school or something. So she develops joint pain or something which subsides on its own. So usually in adults, you will have parvovirus B19 present with joint pains and all that stuff. It does not present with aplastic anemia. It is referred to as aplastic crisis. That means somebody who already has some kind of problems like sickle cell disease and all. When you get parvovirus infection, it will lead to aplastic crisis. All right.
Thanks for watching. Please give a thumbs up and subscribe for more.